Previous slide, ನಾನು ಹೇಳಿದ ಮೇಲೆ ಇದು ಮಾಡು. Previous one. Yeah. So, these clinics basically cater to the poorest of the poor. And Rotary, in these clinics, all these 3 clinics together, they spend around 1.2 lakhs per month. This is the budget the Rotary Club spends on. And we treat almost around 500 patients. 300 at one place, 200 in the other 200 in the other 2 clinics. Next slide, please. So as I told you, 163 clinics. Next slide, please. Next, apart from this, what we noticed is there are people who can afford and they do not want to come to these government hospitals. So we thought of the next idea is we started having paid clinics. You will see this. One is in Honnavar. From 2009 we are still running it. Karkala, and now 2015 April we have started at a very rural place, mainly because what happens is people do not want to be seen visiting a psychiatrist. And mind you, today I had a clinic, and this clinic, it runs on a weekly basis, and again we saw that attendance in this clinic is almost 45 to 50 in one sitting, that is in 3 to 4 hours. So if you look at this, once we started setups in the community, once we started having clinics at their doorstep, people started accepting psychiatry better. So how we did it? Idakku hogu community name. Yeah, see these clinics, how they started. Next slide. We started making pamphlets on mental health. We started conducting college teachers workshop. Wherever we were conducting these mental health clinics, college teachers workshop. We also conducted workshop for primary health center doctors. And we started conducting street plays by our social work school children. And we had school timetables which told about the dates of these clinics. So what happens is the children go and tell their parents, look, we have a timetable. And in this timetable, we used to have signs and symptoms of mental illness. So the parents have a look at it, and that's how they started coming to these clinics. Next slide, please. Next. See, these are the pamphlets. Please. See, this is the pamphlet. The pamphlet gives signs and symptoms of illnesses. The pamphlet gives them the dates. So what happens is children go and tell the parents, and that's how these people started coming, looking at the symptoms, reading about the symptoms. They started visiting a psychiatrist. Next slide, please. So this is one of the lectures in the Parent Teachers Association meeting. Next. Street play by our students of Social Work College about mental illnesses, about alcoholism. Next. So basically, why do you need these satellite clinics? See, what used to happen is, one is it is cost effective, and school children, old people, they can come to these places. What we have noticed is very old people, nobody wants to bring them to the psychiatrist in Udupi. They have to spend for their transport, they have to spend for their food, so many things. So what happened is, these clients save 200 to 250 rupees per visit, mainly for transport. And presently, what we have noticed is, even these children, what happens is, no parent wants them to miss the school. And if the child has some psychological problem, or if the child has some learning disability, they were finding it difficult to come to Udupi. Now they show their children in Karkala. So this is how our numbers began to swell. Next slide, please. Next. Okay, you come to the... So basically, distance, economic factors, service at doorstep, and what we realized is, these satellite clinics started doing well. So this was one thing. Next slide, please. The next facility we have is what is called as this alcohol de-addiction. See, you won't believe, India has 613 districts, and in each district approximately 2 lakh people are having alcohol-related problems. Please understand what I mean. It may be 20 lakh are drinking, that is different. 2 lakhs of them, they have what is called as problem drinking. And to treat these problem drinkers in an hospital is something very difficult. Second thing is nobody will come for these camps. No, nobody will come for these alcohol de-addiction camps. This is where we started these free de-addiction camps. And in fact, as a sequel of these free de-addiction camps, we started having what we call as the de-addiction center. In fact, we run an alcohol de-addiction center in our hospital. So these camps basically is again for the low socioeconomic status patients. So what we started doing is we started arranging these camps in primary health centers, temples, you will be surprised, and in some of these chowltries. You must have heard about this Dharmasthala model, where Dharmasthala Grama Abhivruddhi Yojana, they conduct some camps. They have, in fact, they are far ahead of us. They have conducted more than 1,000 camps. But we, from our hospital, a private hospital, doing a de-addiction camp is unheard of. So what we started is, we started off with the Lions Club Hiryadka. Initially it was for 1 day. And on 1 day, there were 39 patients who attended our camp. We were surprised. So many people coming to take help for alcohol addiction. So with this, we started off with the what is called as a in-house de-addiction camps in various places. Next slide, please. The first one was in Barkur. It is a village. In Barkur, we tied up with the Catholic Sabha. We started having a camp in a school. It is called as the Marinol School. Next slide, please. See, this was the first. We created awareness program with the church, asking patients who want to leave alcohol, they can come and stay in this particular school. You will be surprised, 59 patients stayed in the school. Next slide, please. So seeing this, another Catholic Sabha came up and they said, we will conduct a camp. This was in Nirmala School, Brahmavar. There we conducted a camp. There were 49 people who were enrolled in this. So seeing this, the primary health center in Hiryadka, they came up and they said, we will conduct a camp for our patients. So this is how it started moving, and again here there were 49 people. So wherever we conduct camp, when we were calling them to the hospital, nobody was coming. But when we do it in the community, so many people come, and there are so many factors you will observe. Next slide, please. Next. Camp concept illide. Camp, no, photos ilva, camp. Okay, leave it. So, yeah, next. See, this is the psychiatric evaluation in a school. Camp being conducted in a school. Next slide, please. Next. See, this is we educate the people who are admitted there, we educate them about ill effects of alcohol. Whatever a doctor has to do, instead of doing in a one-to-one situation, here we were doing it for group. Next slide, please. And we started asking community leaders, a lawyer, a college teacher, of course we were making sure that he doesn't drink. So they come and talk. Priests, local political leaders, self-help group leaders, all of these people come and talk to these people, tell them their concept about alcohol-free life. All this, what happened is we were involving the community. Then we are conducting in a community place. So more and more patients come there. Next slide, please. So what happened is, because of this, lot of patients were visiting the camps. Next slide. See, this is the children of alcoholics. They conducted a program. These two people, they are very famous actually. Their father was an alcoholic, but they came up with this, they do this walking on sticks. So these sort of programs, special dance by them. Next slide, please. And we made these alcoholic patients do some work. This is what we call as Shramadan. So we keep them occupied throughout the day. They don't drink. They stay in the school or they stay in the chowltry, and they stay for 10 days. And this is where medical treatment also is given. So this is how we started. Next. Talk by a religious leader. Next. Recreation program by the community people. In the evenings, lot of the normal, non-alcoholic community people will come and give their programs. This is a magic show done by one of the community people. Next slide, please. And we had Alcoholic Anonymous meetings. Next. Alcoholic Anonymous meeting, this is a group of people who have left alcohol who teach others. Next. Next. So what happened was, almost with this, next to the go to the main presentation. Yeah. See, this is the de-addiction clinic which we started in government hospital, where again you will see, next slide please. See, this is how patients used to wait in these de-addiction clinics, because they get free treatment. They want to leave alcohol. See, alcoholism is such a big problem, and basically if you see hospitals, very few of them come. Even today, our de-addiction center, only 60-70% occupancy is there. But if you look at the community camps, lot of them come. So this is what I want to bring to your notice. If they don't come to you, you have to go to them. This is what is the main concept behind this. Next. So what we understood is, alcoholism is a problem. There are many people who will come for this. This is how now what has happened is, we do not go to the community. Every year, twice a year, we conduct de-addiction camp in our hospital. It is free. It is not exactly free. We charge 300 rupees per patient. And they stay 10 days. We look after their medication, their food, everything. Only for 300 rupees. What we spend on the actuals, it is only 10% of the actuals we are collecting from them. But still, you look at the attendance, we have already enrolled 62 people for the camp on 1st of January. So these de-addiction camps have become very popular, and in fact our hospital is known for this work throughout in our entire district. Next. So then seeing this, a temple, you must have heard of this Ambalpadi temple, they came forward for starting a de-addiction program. So every Friday we run a de-addiction program at this Ambalpadi temple, and under their aegis, every year we conduct one free de-addiction camp. Next slide. So this is, and previous is the code. And because of this, the government of Karnataka, they asked us to conduct camps mainly for this police of Uttara Kannada. In fact, more than 100 police constables of entire Uttara Kannada district, they have been enrolled in special camps. And then these Koraga primitive tribes, what we did is, we charge them the actuals. We do not charge them the actual hospital rate. We charge them the actuals, conduct camps for them, government pays, then we keep a follow-up of these patients. And what we realized is, out of 100 patients who come, almost 30 patients, they leave alcohol for a period of 1 year. Next slide, please. The next issue was this child mental health. See, again, I have to talk to you about this stigma. Stigma is so much for mental health, and child coming to a psychiatrist is something you will never hear of. Nobody wants their child, even if the child has problem, nobody wants to bring the child to a psychiatrist. So this is where we started what is called as the school counseling centers, college counseling centers. Then this, with this Amir Khan's Satyameva Jayate, there was a lot of awareness about this child sexual abuse. So there are a lot of children who say we have been abused sexually, and there is nobody who helps them. So this is where we started talking about these things, how we can help them, and we started training our workforce. In fact, my colleague Dr. Virupaksha is there, Mrs. Saujanya is here. Both of them, they have conducted a lot of workshops for children in schools about what is this child sexual abuse, how to deal with it, how to go and speak to, how to face a person who is abusing them, these sort of things. So basically, what we did is, and then there are these children who do not do well in schools. You must, I don't know how many of you have seen this Tare Zameen Par. If you look at this, poor school performance, it's a very big problem. You will be surprised. 15 to 20% of our school children have learning disability. These are children who are good in some aspects of schooling, but very poor in some subjects. In fact, I remember them very well. I mean, I can recognize them very well because I myself was very poor in physics. I was very poor in mathematics. I would have been a failure had I taken up engineering. Maybe they also say that those who are not very intelligent, they become doctors, it seems. I don't know. Many say. Okay. So whatever, this poor school performance is a very big thing. So clinical psychologists, I told you, 54,000 is the requirement, there are 7,000. So what we started doing is we have trained our own staff. I'll come to that, staff training matters. We have trained the little less qualified. We do not have clinical psychologists, we have trained psychologists. We do not have psychiatric social workers, so we have trained our social workers to become psychiatric social workers. So where there was no professional, we have converted somebody into a para-professional and started addressing this. And the biggest thing was proactivity. Proactivity, we started asking schools. Initially we were asking, now they are asking us, but we do not have time to go to schools. We conduct parent-teachers association meetings where we talk about how to handle this scholastic backwardness. Next slide, please. And in fact, we tied up with this Little Rock Indian school. I think students of Udupi, many of you may be the students of this school, a very prestigious school. We trained their teachers. We empowered their children. We gave them these talks, video talks on this child sexual abuse. Next slide, please. So what we started noticing is many of these teachers started referring cases, examination anxiety, depression as a result of child sexual abuse, attention deficit hyperactivity. These are the so-called naughty children who were earlier being beaten, punished, who were being compared, who were being compelled by parents to read. Such children, they have been referred to our clinics now. Next slide, please. And the latest of our initiative is this behavioral addiction, mobile addiction, internet addiction. What we have started doing is we are educating them. What I mean is this is innovation, where we are finding that these problems are more, trying to prevent those problems, educate these children. Okay, look, these are the ways you can handle this. Lot of children, in fact, they themselves come, as I have told, children themselves force the parents. Let's go there, I am finding it difficult. I am finding it difficult to control this. Of course, there are children who grudgingly come also. In fact, when I spoke in one such programs, one of these children, he had the, I can say, the humorous, he sent me an SMS that you are the most regressive person I have seen on earth. You have joined my grandfather and my mother in advising me not to use Facebook more. This is the message I got. But still, there are two sides for this, but still what you should understand is there are a section of society who come asking for help. Next slide, please. This is another school where we have a counseling center called as the Siddhi Vinayaka school in Hattiangadi. Recently, we have handed over that counseling center to one of their own students who has done her MSc in psychology. Next slide, please. Next. College counseling centers. In fact, Ganesh Bhatt knows about this. There is this SMS college, we run a counseling center. And also in our own A.V. Baliga college, we run a counseling center. SMS PU college, we run a counseling center. So these are the places. Earlier, students were not ready to come. And what we have seen is in these counseling centers, students do approach us for help. Next slide, please. So we train the teachers, because teachers are the persons who have to refer the cases. We train them. In fact, this Madhva College, every year we train their faculty. Any new faculties come, we conduct workshops for them. Next slide, please. So this is for engineering students. We conduct a workshop for engineering students. These are my colleagues, psychiatrists talking in the Madhva College. Next slide, please. Child abuse workshop. This was for the ICSE and CBSE Principals Association. We gave them a talk about child sexual abuse. Next slide, please. Now, as I told you, the behavioral addiction. This is the latest, this one we have. Next. Next. Now we'll come to the funding, because finance. See, finance, basic thing is the trust. Our trust, it gives us the money, then the revenue generated from the hospital, donation from philanthropists, donation from other agencies. You will see, you will be surprised. Next slide, please. See this, the current 2015-16, from the trust, 45 lakhs. Revenue generated from the hospital is 2 crores. Donation from philanthropists is only 2 lakhs. Donation from government, other agencies, nil. In fact, right now we have got one project from the government. I am talking about 2015-16 only. Before that, when there were very progressive DCs, I remember Mr. Ponnuraj and Mrs. Hemalata. In fact, they gave us some funding for this primitive tribes for conducting camps and all. Otherwise, the donation from government agencies is nil. Then other sources, there are students who come to learn psychiatry. There are nurses who come to stay in our hospital to learn about psychiatry. The funds received from them, that is their canteen bills and other things, is 7 lakhs. So including our depreciation, the total amount spent was 2 crores 52 lakhs. And almost 40 to 45 lakhs has been given by our trust. In other words, we are in fact running under loss if you look at it. But of course, our chairman has a view that we are supposed to do this charity work. So this is not a very big amount. But look at the actuals. I am just talking to you about the actuals. And what I have noticed is the uniqueness of my organization. I was telling Mr. Bhatt also, see, being the CEO, I do not even have a written order that this is your duty or this is the thing or this is your remuneration. Whatever it is only based on trust. Let me tell you very frankly. You may say, I am impractical or my trust is impractical, but this is a fact. And whatever amount, and I can tell you, everything is accounted. We do not receive any off the track donations. We do not do, and everything, and credits to our accounts officer who has been managing these things very well for the last 15 years. There is absolutely, I can say, we have been, in fact, he wants me, whenever there is when the things are slack, how to improve it, what are the things we do. We are trying so many innovative things. I'll come to that towards the end. Next slide, please. The current working team, mental health, as I told you, see, we are 4 psychiatrists. Then there is a physician, there is a pediatrician, basically for child psychiatry things. Then there are the social workers. 15 of them, one is psychiatric social worker. The others are all qualified psychiatric social workers, but qualified by experience. They do not have the what we call as the PhD or MPhil. Then we have 2 psychologists, occupational therapists, then we have a special educator, yoga therapist. So this working team, we improve their capacity, we improve them as individuals. Adakku capacity building idakke. So what we do is workforce development. Basic thing is, see, necessity is the mother of invention. We did not have a psychologist who can deal with children. In fact, incidentally, Mr. Nagaraj Murthy is here only. We sent him for training to Madras for a 3 months training, and with the help of him and with the help of 2 teachers who had done their MA and B.Ed, we started what is called as this poor school performance. For those children, we started child guidance clinic. Today, 300 children attend this. 300 children every week. They come for our these classes for remedial training, and we have now almost 7 to 8 staff who are working in this area. Next slide, please. So this is the current staff who are working in this particular area. Next slide, please. And we conducted a workshop on child sexual abuse for our own people by Nimhan's team, role of therapies in autism. Then we also conducted some special therapies which are required. So our staff were trained by experts from Nimhan's, from Bombay, various places. They come to our place. And again, all credits to my colleagues, psychiatrists and clinical psychologists who have been monitoring this workforce. They are not as qualified as you would expect, because in India you can't expect this ideal situation. Next slide, please. So these are this personality development program. My colleague psychiatrist Virupaksha is here. He conducted personality development of our own staff, our own social workers, how to interact with patients, how to interact among themselves, so many things like that. So these sort of classes occur every month in our hospital. Next slide, please. Next. Then the next part is our patients are treated. They come here, they get well. Many times, many of them cannot get jobs. That is the thing. You know, psychiatry, normals only, they are not getting any jobs now. How do you expect somebody who is having some deficiencies? So this is where we started having this concept of rehabilitation center. In fact, you will be surprised to rehabilitation. See, what we have done is, we have, in our own hospital, around 25 people who were ill at one time, who are there. Statistics go. See, right now, we have semi-sheltered employment. Semi-sheltered means they are in the hospital itself, they go out and work and come back. Daily travelers, 18. Daycare center, there are patients who come from home, they come to the hospital and do some work. You will see what work they do. Next. Next, Togo. Next. Next. No, either previous one. Yeah. Basically, there are ward boys, ayas, marketing executive. You will be surprised who is this marketing executive, what he does, I will show you. Security, supervisor, art teacher. These are all, many of these people who are working in the hospital are our ex-patients. You will be surprised. And hospital bears expenses of almost around 85,000 per month, which is for this rehabilitation. Currently, there are 10 boarders who attend because they cannot be looked after at home. They come and stay in our center. They sit in our center and go back. Next slide, please. So what they do, in this center, they make covers for our hospital pharmacy, which are distributed by our marketing executive. He goes outside and he is also an ex-patient. He sells these covers, artificial jewelry, diyas for Diwali, artificial flowers and mementos used in this one. Then we have a small shop in our hospital itself, which says that these are things which are made by our patients. Please buy them. Photos go. See, these are all paintings made at our hospital. And these are some greeting cards. This is our stall. Previous one. This is the stall where we sell this artificial artificial jewelry, then the greeting cards. Next. These are the diyas. In fact, you will be surprised. During Deepavali, we actually put around 5,000 rupees, but we got 40,000 rupees. See the income it has generated. So this is the latest one. Next slide, please. So this is our honorary judge who had visited this one of our stalls and bought certain things. Next slide, please. So, steps to curb stigma. Oh, innovation I was talking about. See, because psychiatry hospital should be a visitable place. What we started doing is, we have again my friend Virupaksha, he is the main person who has been conducting these programs. He started organizing this monthly, in a year, 1 or 2 programs regarding literary things. This is called as Nadu Mane Sahitya. This is Nadu Mane means it is in the house Sahitya, but we made it Nadu Hospital Sahitya. It was some literary club. In fact, normal people from all over Udupi who are interested in literary activities come and visit this particular hospital. And they visit, they see, then they understand, okay, this is a place, it is like any other hospital. Because I am sure if I ask you, what is your concept of psychiatry hospital, you will say people will be behind